Good day, sir. This is Group 5, in which we will present our topic Contemporary Global Governance with Integration of COVID 19. First and foremost, we would like to state that this is for educational use only. Our group is allowing our instructor, Mr. Roldan Ardines, to use this as an educational material. Our objective is that to know the effects of globalization on governments, to identify the institution that govern international relations, and to differentiate the internationalism from globalization. I am Deck Cadet Arca Miguelito. I am assigned to explain what is a global governance. A global governance comprises operation at the international, transnational, and regional levels that cross national borders and is based on the rights and laws enforced through a combination of economic and moral incentives. A global governance encompasses activities that transcend national boundaries at the international, transnational, and regional levels and is based on rights and rules that are enforced through combination of economic and moral incentives. This explains that a global governance broadly defined aims to deliver global public goods such as peace and security, dispute resolutions and mediation mechanisms, functional markets, and harmonized trade and industrial standards. Today, the United Nations is the most powerful agency in charge of global governance. In accordance to contemporary global governance with integration of COVID-19 is that with the spread of the global epidemic came an increase in racializing discourse. The virus was incorrectly assigned to people of Chinese ethnicity based on the fact that the first recorded phase of epidemic occurred in Wuhan. The President of the United States, who frequently referred the issue as the Chinese virus, aided and abetted this racial interpretation. This racialization was not limited to President Donald Trump, and it compacts Asian Americans in Europe and North America directly. Racializations also plays a role in China, where African immigrants are subjected to prejudice and harassment as country implements anti-virus legislation. The recent COVID-19 pandemic necessitates urgent talks in the field of health security and global governance. Traditional research on healthcare and global governance have recognized the importance of the term global based on the reality that epidemics and pandemics do not stop at national borders. The COVID-19 epidemic was thrown a wrench into the norm diffusion hierarchy. Despite structural conduct of many nations addressing the crisis, such as China, the United States, Italy, South Korea, and India, offer a suitable environment for integrating national level decision making into the global versus local discussion. The paper contributes to our knowledge of the need for an effective examination of the transmission of norms by building on arguments from norms theories of diffusion.
Good day, I am Cadet Lasan B, and I'm going to explain about the effects of globalization in on governments. So, we propose that the observed hesitancy in policy implementation by countries with high government efficiency and globalization is a result of adherence to existing trade agreements, a greater desire to learn from the others, and possibly a lack of confidence in a government ability to deal with a pandemic via its health system and state capacity. The current COVID-19 pandemic has revealed huge disparities in methods to coronavirus control and containment around the world, as well as the varying success of such effort in reducing coronavirus transmission. While prior research has shown that adding any travel data and government policy responses into global disease transmission modeling has a high predictive value. Variables in influencing the chance to impose travel and border restriction policies have received far less attention. So, during the coronavirus epidemic, this research investigates the impact of globalization and the acceptance of international travel-related non-pharmaceutical interventions with empirical evidence. These studies intends to provide recommendations on how to improve global planning, preparedness, and coordination of activities and policy responses during future infection disease pandemic. So all about that was we should always be ready through the pandemic. So even though there's no pandemic, we should be always ready, and we have a planning so that in case of a pandemic we're all ready, and we should be aware of the global pandemic and governments, because some implementations by other countries are not so efficient. So our result of adherence, it may become like it may become a disturbing for others because they are not ready for the pandemic. Like the Philippines, in marketplace will be out of stock of face masks, face shields, alcohol, first aid kits like paracetamols and something. So we should be ready, observant, and hesitant, so that global planning may implement to others. So that's all, and God bless. Thank you.
So, good day everyone. I am Cadet Dagongdong. I am from Group 5. Today, I will discuss our topic. Identify the institutions that govern international relations. First, the COVID-19 pandemic affects all countries. But politics determines how governments respond. In the midst of this, the World Health Organization has attempted to coordinate guidance to nations and provides continuing epidemic management. In 2019, the introduction of a novel coronavirus, SARS-CoV-2/COVID-19, could be the most significant event of the early 21st century. Upending modern life, globalization, and international relations, COVID-19 is a public health emergency with an estimated 3 million illnesses and over 200,000 deaths so far. It's also a financial issue, as various stay-at-home ordinance and travel limitations enacted to break the transmission chain have resulted in substantially reduced economic activity, massive unemployment, and money losses all over the world. The global response has been symbolic and mostly coordinated, from China's initial refusal to allow World Health Organization experts enter the nation to G7 battles over what to term the virus to President Trump's hold on financing for the World Health Organization. Global public health has generally been more favorable to cooperation than other issues areas. The joint gains of working together to avoid infectious disease and minimize economic disruptions are large. Controlling a pandemic is, if not a harmony game, at least an assurance or stag hat game, where actors will cooperate if they trust the others will do so. The absence of cooperation in this instance is therefore somewhat puzzling. Countries should be working together. The United States and the Soviet Union found it within their interest to cooperate and even outdo each other on smallpox eradication in the midst of the Cold War. More recently, the US and China cooperated on range of issue, Obama era from financial crisis, climate change to the Ebola outbreak. However, as Scott Barrett has noted, efforts like a smallpox eradication which required a modest amount of money. In public health, where the costs of inaction are so large, some of these concerns about relative gain should be attenuated. That said, where public goods are involved, as they are with global health and coronavirus, there are collective action problems. It is hard to induce countries to contribute to public goods if they can get them for free. This is a classic problem of collective underprovision and free riding at the Moncur Olson, Eleanor Ostrom, Todd Sandler, and others scholars of collective action have identified. One way such cooperation in the economic arena was historically generated occurred when a single dominant power was willing to underwrite public goods provision. That's all. Thank you.
Good day, sir. I am Mark Steve M. De La Torre. Differentiate the internationalism from globalization. Globalization is the expansion of ideas, knowledge, information, goods, and services across the globe, while internationalism is most generally defined as a respect for the world's varied cultures and a desire for world peace. Globalism in business. The word is used to define integrated economies that are characterized by free trade, open capital flow among countries, and easy access to foreign resources, especially labor markets, in order to optimize and benefits for the good common. The convergence of cultural and economic system drives globalization, as it is known in various parts of the world. Increased engagement, integration, and interdependence among nations is encouraged, and in some circumstances, required by the convergence. The world grows more globalized when more countries and areas become politically, culturally, and economically intertwined. Internationalism. Intergovernmental organizations, or what we call IGOs, such as the UE, African Union, World Bank, UN, NATO, ASEAN, IPCC, WTO, Mercosur, OECD, and League of Arab States are the most visible stances of internationalism today. Changing events or actions within certain nations can have a ripple effect that extends far beyond nations' border. As a result of increased globalizations, the Arab Spring, the global financial crisis, the internet, and Brexit are all prominent instances. This can be troublesome when the entire world suffers as a result of a decision taken by a single nation over which they have no control. International system with some sort of responsibility tied so such forces would attempt to mitigate, attenuate, or increase the good effects of such forces. That's all. Thank you.
Roles and functions of United Nations. The reactions to the COVID-19 pandemic has been the focus on UN system organizations, actions and result of coordinations who over past years. The goal of joint work was to mobilize and align UN system-wide support to member states in response to the COVID-19 pandemic, as well to support intergovernmental discussions in main UN government bodies and to continue efforts to deliver essential health service, develop global public health goods, and achieve the sustainable development goals. This collaborate approach, which was put in initial implementations, has proved the benefits and possible of UN reform. Recognizing the impact of the COVID-19 pandemic on global trade, travel, supply chains, and money, who swiftly reached out to heads of UN agencies, funds, and programs for many sectors to raise awareness of other outbreaks, seriousness. Individual UN entities were asked to analyze the risk in maintaining operations at all levels and take corrective measures according to the WHO for immediate socio-economic response to disaster, who has led the programmatic alignment of the WHO strategic preparedness and response plan.
Good day, I'm Cadet Dalanon Renico and I'm from Group 5. So today we're going to talk all about the challenges of global governance in the 21st century. So as a common issue for the worldwide society, public health events necessitates a coordinated response from all of humanity. The COVID-19 outbreak has brought to light issues with global public health governance, such as international organizations' limited functions and difficulties in achieving objectives, poor collaboration between governance subjects and their limited performance, overlapping legal basis of governance and blurred core functions, and a lack of solutions to specific problems. So, at the turn of the 21st century, it was widely acknowledged that the national and worldwide health are inextricably linked. In less than a month, the COVID-19 virus had spread to several countries. The true scope of its impact on the global economy, government systems, and people's livelihoods is unprecedented and enormous, but it remains unknown. These international public health catastrophes have increased the uncertainty and difficulty of human efforts to regulate them. Global health governance issues have long piqued the interest of legal and political scientists, With the recent COVID-19 epidemic, it is past time to reevaluate the current landscape of international health cooperation, which is supported by a variety of legislative standards, processes, and institutions. The COVID-19 outbreak will put the efficiency of the vaccine to test once more. So, as we were on the edge of the 21st century, societies have become more willing to establish an international balance of powers, global governance, the collective management of common problems at the international level is at a critical juncture. Although global governance institutions have racked up many successes since their development after the Second World War, the growing number of issues on the international agenda and their complexity is outpacing the ability of international organizations and national governments to cope. It was expected that the globalization would be fortified by a system of global rules, regulations, and a network of specialized global institutions. 2 decades later, such aspirations have been dashed by a series of global governance setbacks and the rise of economic nationalism. From trade to the environment, a retreatment from multilateralism is observable. With the emergence of rapid globalization, the risk of international systems have grown to the extent that formerly localized threats are no longer locally containable but are now potentially dangerous to global security and stability. And at the beginning of the century, threats such as ethnic conflicts, infectious disease, and terrorism, as well as a new generation of global challenges including climate change, energy security, food and water scarcity, international migration flow, and new technologies are increasingly taking center stage. So, supporting the role of international organizations in achieving the objectives, enhancing coordination among international governance subjects to form synergy, promoting compliance with IHR 2005 to avoid conflict of law application, and upholding the vision of community with a shared future for mankind to jointly respond to special problems are some of the approaches that can be taken to improve the efficiency of global public health governance. That's all. Thank you.
For further explanation of the topic challenges of global governance in the 21st century. Good morning, sir. Good morning, classmates. So I'm Cadet Distora Anjo M. I'm going to report the challenges of a global governance in the 21st century. As a common issue for the worldwide society, public health events necessitate the coordinated response from all of the humanity. The COVID-19 outbreak has brought to light issues with the global public health governance, such as the international organization limited function, the difficulties in achieving objectives. 4. Collaboration between governance subjects and their limited performance, overlapping the legal basis of a lack of solution to a specific problem. At the turn of the 21st century, it is widely acknowledged the national and the worldwide health inextricably linked. At least a month of the COVID-19 virus has spread to several countries. The true scope of its impact on the global economy, government system, and the people of livelihood is unfortunately unknown. This international public health catastrophe has increased the uncertainty and the difficulty of the human efforts to regulate them. Global health governance issues have long piqued the interest of the legal and the political scientists. With the recent COVID-19 epidemic, it is the past time to evaluate the current landscape of the international health cooperation, which is supported by the variety of the legislative standard. Process in the institution of the COVID-19 outbreak will put the efficiency of the vaccine to a test once more. Supporting the role of the international organization in achieving the objective enhanced coordination among the international governance subject from the synergy promoting compliance with IHR 2005 to avoid conflict of the law application. And upholding the vision of the community with a shared future for mankind to jointly respond to especially problems are some of the approach that can be taken to improve the efficiency of the global health, public health governance. And also, the beginning of the century threats such as the ethnic conflicts, infections, disease, and the terrorism as well as new generation of the global challenges including climate change, energy security, food and water scarcity, international migration flow, and new technologies are increasingly taking a center stage. New globalization of the fragmentation of the Western of the centralized global governance system has led up the situation in which emerging economies have the ability to place over the direct pressures of the particular aspect of the process of the global governance, but also to highlight the lack of the legitimacy of the surrounding. And we need the more exclusive global governance because there is no longer any century or a small group of the countries that enjoys the global economy supremacy. Emerging economies represent around 86% of the world's population in the 50% of the world's GPD in the PPP terms. They are now the main source of the global economic growth. Thank you and God bless all.
I am Dec Cadet Ragaza and now reporting the relevance of the state amid globalization. The way we live and earn a living has changed. As a result of globalization, trade and travel have been identified as important factors of disease dissemination. Furthermore, global connection has been helped by the development in urbanization and tighter integration of the world economy. As a result, globalization has emerged as a critical disease transmission mechanism. The purpose of this article is to look at the influence of COVID-19 on globalization and global health in terms of mobility, trade, travel, and the nation that are most affected. We all know we are all affected of the pandemic. The economy is getting down because of the pandemic that people cannot get out of their house in their apartments because of COVID-19. And we all know COVID-19 is harmful. That's why all people cannot do the work and cannot buy anything that goes to our economy. Globalization's impact was measured in terms of mobility, economy, and healthcare systems. Individual mobility, its scale were determined using airline, seaport trade, as well as trip information, the workforce, event cancellation, food and agriculture, academic institution, and the supply chain were all used to calculate the economic impact. The healthcare capacity of countries was examined by looking at healthcare system indicators and country readiness. We calculated a pandemic vulnerability index (PVI) by generating a quantitative measure of the potential global healthcare using a strategy to order of preference by similarity ideal solutions. Healthcare systems indicators that they indicate which country is ready for the pandemic and already travel, event cancellation, employment workforce, food chain, academics, and healthcare capacity. The pandemic has imposed an unprecedented pressure on the international economy. Pandemic has given pressure to the economy because, just as I say, people cannot do the work of each their job because pandemic making them trapped in their house, apartments that they cannot get out. Pandemic, as we all know, the economy has recovered in the pandemic, has imposed an healthcare and globalization. Certain countries were more vulnerable than others. According to PBI, these countries has more vulnerable in healthcare and globalization. South Africa and Egypt were more vulnerable countries in Africa. Russia, Germany, and Italy were more vulnerable in Europe. India, Iran, Pakistan, Saudi Arabia, and Turkey were more vulnerable in Asia, Oceania, and Brazil. The United States, Chile, Mexico, and Peru were more vulnerable in the Americas. The effects of mobility, the economy, and healthcare systems have only recently begun to emerge. The findings of this research could aid in the development and implementation of strategies at the national level to assist alleviate this growing load.
I am Deck Cadet James Anthony V. Lapasa. And for further explanation of the topic relevance of the state amid globalization as the primary cause in global interconnectedness, the nation function states in a global world is essentially regulatory, while the nation domestic states function remains largely intact. Historically isolated governments are now required to engage with one another in order to determine international trade policy. These interactions may result in diminished roles for some states and exalted roles for others due to various economic imbalances. The nation role states in a global world is largely regulatory as the primary factor in global interdependence, while the nation domestic states function remains largely intact. Historically isolated governments are now required to engage with one another in order to determine international trade policy. These interactions may result in numerous economic imbalances. Globalization has altered the function of the state in numerous ways. Politically, through state interdependence and independence; socially, through terrorism and deadly diseases; technologically, through the media and the internet; and economically, through the shift from national to global economies. Globalization has had a significant political, economic, and cultural impact on nation-states. These three factors all pose a challenge to the nation-state. They erode they erode sovereignty, render economic activity unstable, and make it simple to destroy national culture as a result of cultural globalization. That's the primary cause in globalization. That's all.